Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. I'm Steven Newmark, Chief Policy Officer at the Global Healthy Living Foundation. Our goal is to help you understand what's happening in the healthcare world to help you make informed decisions to live your best life. As we wrap up 2025, today's episode takes a step back to look at some of the major public health developments from the past year and how they shape policy, healthcare delivery, and patient experience. Rather than focusing on a single issue or interview, this episode serves as a year-end recap, highlighting several stories that dominated public health discussions in 2025 and will likely continue to influence the landscape in the year ahead. Let's start with leadership. One of the most consequential public health developments in 2025 was the appointment of Robert F. Kennedy Jr. as the Secretary of Health and Human Services. President Trump said he's going to, quote, let Robert run wild as HHS Secretary, and he has started to do that already. HHS oversees a wide range of federal health agencies, including the CDC, the FDA, the NIH, CMS, and others. As a result, leadership changes at HHS often carry implications across healthcare regulation, public health guidance, and federal research priorities. Throughout the year, public health stakeholders closely monitored how the department approached vaccines, regulatory oversight, and interagency coordination. While many existing programs continue to operate, the transition prompted renewed scrutiny of advisory processes. For patients and providers, the year brought heightened attention to how federal health leadership influences guidance and implementation across the healthcare system. One of Secretary Kennedy's key roles is the appointment of members to the Advisory Committee on Immunization Practices, or ACIP. ACIP meetings were one of the most closely watched public health processes in 2025, and they had several key votes that we'll discuss now. ACIP met multiple times throughout the year to review vaccine data and vote on recommendations that directly affect clinical guidance and insurance coverage. Several of those meetings drew heightened attention due to both the timing and the substance of the votes. In early 2025, ACIP reviewed updates to routine immunization schedules, including discussions around pediatric and adult vaccine recommendations. Later meetings addressed booster guidance, risk-based vaccination frameworks, and how recommendations should apply to specific populations. The committee revised long-standing universal recommendations and shifted towards more targeted or risk-based guidance. These votes had downstream implications for coverage under Medicare, Medicaid, and private insurance plans, as well as for state-level implementation. Throughout the year, ACIP discussions highlighted the complexity of translating clinical trial data into population-wide guidance, particularly when balancing safety and effectiveness. As in prior years, ACIP's role remained advisory. Final implementation depended on federal agencies, payers, providers, and the public health systems at the state and local level. For more on the recent ACIP meetings and what it meant for the Hep B vaccine, check out our recent episodes regarding that discussion. Turning generally to vaccine access and uptake, 2025 highlighted ongoing challenges related generally to vaccine access. Patients encountered a lot of logistical hurdles obtaining vaccines, including variability in availability across pharmacies and clinics, reimbursement complexities for providers, and differences in coverage depending on your insurance type. Public health experts continue to emphasize that access is influenced not only by recommendations, but also by distribution systems, provider participation, and patient awareness. As a result, even when vaccines were formally recommended, uptake varied significantly by region and by population. These access issues remain a key focus for GHLF and public health generally moving forward. Turning to prescription drug policy and Trump Rx. Prescription drug affordability remained a major policy topic in 2025, including renewed attention to proposals from President Trump under a new rubric that he calls Trump Rx. These efforts by President Trump emphasize reducing drug pricing through regulatory and market-based approaches, drawing both support and questions from stakeholders across the healthcare system. As with many drug pricing initiatives, discussions centered on balancing affordability with access, innovation, pharmacy sustainability, and payer dynamics. Policymakers, patient groups, and others continue to debate how to best address rising out-of-pocket costs, and this is something we'll surely keep an eye on as we enter 2026. Relatedly, another storyline involved the continuation in the implementation of the Inflation Reduction Acts, or the IRA's healthcare provisions. Federal agencies spent much of the year operationalizing drug price negotiation, as well as insulin cost caps for Medicare beneficiaries and changes to out-of-pocket spending limits. While these policies were technically enacted earlier than 2025, this year marked a transition from statutory language to real-world implementation. For patients, the actual impact varied. Some saw lower costs at the pharmacy counter, while others experienced confusion as plans adjusted formularies. Health systems and others continue to monitor how these changes will affect access moving forward. A big story in 2025 is the expansion of GLP-1 medications. It's one of the most visible trends in 2025, and it continues to grow as we enter 2026. Originally developed for diabetes management, GLP-1 drugs expanded into broader use for weight management and other related conditions. Demand increased sharply throughout 2025, leading to ongoing conversations about supply, coverage criteria, and clinical guidelines. Patients reported varied experiences accessing these medications depending on your insurance coverage and, again, on geographic location. This expansion highlights the broader challenge in managing chronic disease at a scale within a system as large as ours. Taken together, the public health stories of 2025 reveal several recurring themes. First, leadership and governance continue to shape how science translates into policy. Second, advisory processes remain central to access and coverage decisions. Third, logistical and administrative barriers play a major role in patient experience, not surprisingly. And finally, innovation often outpaces the systems designed to deliver care equitably. These dynamics will continue to influence public health discussions into 2026 and beyond. As we head into the new year, the events of 2025 offer important context for understanding where public health policy and healthcare delivery are headed. At the Health Advocates, we'll continue tracking these developments, centering patient experience, and examining how policy decisions translate into real-world evidence. From all of us at the Health Advocates to you, we wish you a very, very happy holiday season. Merry Christmas to all, Happy Hanukkah to those who celebrate, and a very happy New Year. Thanks as always for listening to The Health Advocates, a podcast that breaks down major health news of the week to help you make sense of it all. If you found this episode helpful, please leave us a rating or review and share it with someone who cares about healthcare policy. And be sure to follow us wherever you get your podcasts. You can find all of GHLF's podcasts at ghlf.org/listen. I'm Steven Newmark, and we'll see you in 2026.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.